All set, Senator. You ready? Yes, ma'am. All right. So good morning, everybody. We're here today for our hearing. Commissioner Gifford and Commissioner Chef. Commissioner Gifford, you want to start out first?
Yes, thank you, Senator Austin. Good morning to you and Senator Moore and Representative Abercrombie and Walker and all of the members of the Human Service and Appropriations Committee. Thank you for having us here this morning. I'm Deidre Gifford, the Commissioner of the Department of Social Services. I'm joined by some members of my team from DSS, and I'll shortly turn it over to Commissioner Chef, who will have the majority of the presentation this morning. I did just want to say that this is our second hearing now in the series of approvals for emergency authorities under the American Rescue Plan Act, Section 9817. Just for the committee members who may not recall, this is the part of the ARPA that provides 10% extra federal funding for all of the home and community-based services provided between April 1st of 2021 and March 31st of this year. And then allows us to reinvest that 10% and receive additional federal match through March 31st of 2024. We have received approval for our plan, conditional approval for our overall plan, of which this morning's presentation is a part. But we also need to receive the specific spending authorities for each segment of the plan, and that's the waiver authority that we're requesting you review and approve this morning. So as the single state Medicaid agency, DSS is obviously responsible for the overall plan, but this part of the waiver is operated and managed by DDS. So with that, I will turn it over to Commissioner Chef, who has the details on the Appendix K waiver amendment that's before you. And members of the DSS team are also here to answer any questions you might have. Thank you very much.
Thank you, Commissioner Gifford, and thank you to the esteemed legislators who are attending this morning for this hearing. I'm pleased to be here. As Commissioner Gifford stated, we are here today to seek your support for the Appendix K Emergency Preparedness and Response Amendments to be effective upon approval from the Centers for Medicare and Medicaid Services. As allowable under Appendix K, these options may be made retroactive to July 1st, 2021 upon approval by CMS. The three HCBS Home and Community-Based Service Medicaid waivers operated by DDS are as follows: Comprehensive Supports Waiver, Individual and Family Support Waiver, Employment and Day Support Waiver. Appendix K amendments are temporary and expire 6 months following the expiration of the federal public health emergency. The majority of the amendments are focused on waiver changes that are necessary in order for DSS and DDS to expend funds provided through Section 9817 of the American Rescue Plan Act of 2021 in accordance with the ARPA HCBS spending plan already approved by CMS. The following is a summary of the proposed changes. Within the ARPA HCBS spending plan provisions, stabilization payments, DDS will pay a series of 4 one-time payments to DDS qualified providers over the ARPA period through 3/31/2024 to assist qualified providers impacted by the pandemic, as well as to assist with recruitment and retention of provider staff. Incentive-based outcome payments. Our payments will be made to any DDS qualified residential provider that transitions a DDS waiver participant from a congregate residential setting, group home or CRS, towards a more integrated community-based setting. DDS will require a minimum stay of at least 60 days in the community-based setting in order for the CLA or CRS provider to receive the outcome payment. The payments will cease once all the funds as noted below are expended. Temporary rate increases for specific waiver service authorizations. Rate increases will be implemented for specific employment and residential waiver service authorizations covered under the waivers that move a waiver participant towards a more independent residential setting or towards competitive employment. The rate increase will apply immediately upon transition in the following scenarios. The existing qualified residential providers of congregate settings for the amount of time it takes to fill the vacancy with individuals identified as an emergency need of residential supports, or the time it takes to restructure the current setting to meet the needs of those on the residential wait list. The new qualified residential provider accepting the individual into a more independent setting for an identified limited time period to acclimate the individual into the new setting. The existing day employment provider for an identified limited time to restructure the current program. The employment provider accepting the individual into a more competitively based employment service. Also, payments for qualified providers to modernize billing processes and systems. Payments will allow providers to purchase necessary technology and make improvements to current technology in order to modernize their business system. Payments will be made through a series of 4 one-time payments over the ARPA period. Temporary increase in the cap for assistive technology. Service amount cap for assistive technology services will temporarily increase from $15,000 to $30,000 per participant to promote and enhance independence. In a separate Appendix K application, which was separated out per the request of the Center for Medicaid and Medicare Services, the state is also requesting the following non-ARPA related provision: retainer payments. DDS is proposing to claim federal match for an additional 3 30-day periods of provider retainer payments retroactive to January 2021 for all habilitation programs, both residential and day, that include personal care to ensure continuous operations and sustainability of waiver services. Retainer payments are made to providers even though the individual is absent from the program. As providers are only paid for when an individual is present in a program, during the pandemic, this became a major hurdle for providers that were experiencing COVID-related closures and absences. CMS has authorized these additional payments in light of the extended duration of the federal public health emergency. Pursuant to Connecticut General Statute 17B-8, a notice of intent for public review and comment on the Appendix K amendments was posted on both departments' websites and published in the Connecticut Law Journal beginning January 18th, 2022 for a period of 30 days. There were no comments submitted in response to the notice of intent. A letter notifying the committees of cognizance of the department's intent to submit the Appendix K amendments was transmitted on February 17th, 2022. The departments respectfully request committees approve the Appendix K amendments as described. Staff from both DSS and DDS are here with me today to help answer any questions. I thank you for your time and for allowing me to read testimony. Most of you know that I tend to speak extemporaneously, but this was technical in nature. So thank you for indulging me.
Very much, both Commissioner Schepp and Commissioner Gifford. Are there any questions from colleagues? Representative Case.
I'll let the good chairwoman go ahead of me if that's okay.
Representative Abercrombie.
Thank you, Representative Case. Good morning, commissioners. Thank you for being here, and thank you to the staff from DDS and DSS. A couple of quick questions. On the incentive-based outcome payments, what's the formula you're going to use for those payments?
I'm going to see if one of my staff is able to answer that better than I'll be able to.
Yeah, Representative Abercrombie, what we're looking at is it would be an incentive based in terms of if they're successful, we would give them a lump sum outcome payment. And I believe we're looking at, and I hope one of the staff can verify that, but I believe it would be like a $5,000 payment that we would give them in order to help incentivize.
Okay, thank you. And then going on for my second question, under the temporary increase in the cap for assistive technology, going from the 15,000 to the 30,000, I know it's based on the recipients. Are agencies, sort of like the ARCs, able to apply for those dollars for their clients? How does that work?
Thank you, Representative Abercrombie. All of those funds would flow through providers' whether it be the Tech Act centers operated by Aging and Disability Services or providers who have other access to implementing the technology through our waiver. So they'd be provider-based payments.
And
So
also,
it's
if there's anybody who's doing self-hire, they would be able to qualify for those as well.
And how much of those dollars are still available? Have you been, because I know we already used a pocket of ARPA dollars for assistive technology. Is this above that, or are you including this money in that pocket?
This cap increase would allow us to spend more on a per person basis, but there are available funds, and this would provide additional funding to do so.
Thank you, Commissioner. Thank you, Madam Chair.
Thank you very much, Representative Abercrombie. Representative Case.
Thank you, Madam Chair, and thank you, commissioners, for both being here. Just a couple comments, and then I have two questions. And I heard earlier that this is the second time it's heard. I believe the first time is an informational hearing, which is fine. I think this is great because now we have both full committees together, so they can hear and they can ask questions. So my first question is, when will the first dollar of the 58 million hit the ground?
Upon approval from CMS, we can begin processing payments according to this. Nick Gerard is on the call with me, who assists the department with structuring payments. And I don't know, Nick, if you have a specific timeline post approval from CMS.
Yeah, 5 to 10 business days.
So this will go to CMS when?
Upon approval, CMS is already aware of the plan. The approval process now, and we have conditional approval, is to notify them, presuming the committee approves this today. We will transmit that approval to them, I believe. And I'm not sure, Krista or Nick, when we would anticipate final approval.
We have a meeting today with CMS this afternoon. We've put in a informal write-up of this, and we have a meeting with them today. And if there's approval today, then we'll put the formal in based on the feedback from the meeting we have. And then once we get the feedback, that's when, as Nick said, it'd be 5 to 10 days from there.
Okay, thank you. And I know there'll be many more questions coming forward later on because people are anxious to get these dollars. And my concern is, and I think we'll look at this in the future, and I think Representative Abercrombie and we've spoken on this, and I don't want to speak for her, but the dollars were 2021 and they're getting to the people 2022 or to the agencies. I just like to look and dig deeper to see when dollars like this are approved, how we can expedite pandemic dollars and emergency health dollars to get to the people during that time, because now we're talking about March and April of getting dollars that were approved last April. So I guess that's more of a comment. I'd like to look at that and see how we can further that, because these are the most vulnerable people in our state, and the $58 million was put there, and it's really tough to see it a year later get into the nonprofits and to the healthcare people who actually take care of our most vulnerable. So I guess that's a question off the record we can have later on. With that, I'll let the next one speak. But thank you very much, commissioners, for being here.
Thank you for having us.
Thank you very much, Representative Case. Representative Aurora.
Thank you, Madam Chair, and thank you, Commissioner, for your testimony and for being here with us. A few quick questions. The first one: do you have any kind of?
Excuse me, Representative Aurora, 2 questions per person.
Okay. Thank you, Madam Chair. Do you have a breakup of the 58 million between the various categories, especially how much will go as increased compensation to CNAs versus other categories?
I don't have that in front of me at this moment. I don't know, Nick or Krista, if you can speak to that.
Yeah, so we don't have that level of detail. Right now, for the first payment, our plan is to distribute it by providers and give the providers guidance on how they can use those funds. So that's still something that we will need to provide to providers as we push out that money.
Okay, thank you. The real issue here and this is a comment, is that we do want our CNAs to get paid more, and that's an urgent need. And so many of our members do believe that that should be the focus, and we would really appreciate if we could get some percentages so that the majority is going to our CNAs, that it's not that 10% trickles down to the CNAs and 90% to providers for other purposes. The second question which I have is, there are a number of these programs, 3 of the programs for assistive technology and so on. Have you put together some metrics, because this is a substantial amount of money, to see and report back or to check later whether these programs are delivering and being effective? Because when we put that kind of money, I think from a government perspective, it's extremely important to have some accountability or even a feedback mechanism to estimate the efficacy of these programs. There are 4 different programs. Have you, as a part of the allocation of this substantial amount of money, laid down some rules or some feedback mechanism to be able to say, okay, this one worked, this one didn't work? And if so, can you talk to those and whether you're sharing that with the providers or making them as preconditions?
Thank you, Representative. Within the incentive-based payment structure included as one of the elements under request for Appendix K, there are benchmarks in terms of how we would measure success, length of stay, post-transition, quality of stay. We do have quality review processes in place. With regards to technology, most of the technology in play and most of the things that we're talking about within that line item are evidence-based practices. They're not necessarily things made up on the fly, so to speak. So remote supports, adaptive technology, the use of pill minders, and a variety of other things are all things that are evidence-based. In terms of developing metrics, we would be able to see that through reduction in individual expenditures were that to occur. And we have plans to measure the effectiveness of that. Tied together throughout these options, we've tried to weave in incentivizing the system to remove people from the wait list. So a reduction in the wait list in parallel to this would be a strong indicator for me of our success. And I don't know if other staff have particular comment on measures or metrics before I conclude that response, Representative Aurora.
Commissioner Sheff, this is Christos Chesky. If I can just note one quick additional item related to reporting outcomes. So as part of the HCBS ARPA spending plan, there is also a requirement that we provide quarterly reports to CMS on updates on how each of the initiatives are moving forward. So that's going to be another mechanism in which we will be providing updated reporting requirements, updates about successes related to each of the initiatives. And that's going to be done on a quarterly basis throughout the ARPA period. The other sort of point that I think is important to note is that the assistive technology provision that increases the cap from 15,000 to 30,000 still has to fall under the requirements of assistive technology under the waiver. So our waivers do already provide specific provisions in which assistive technology can be utilized. So this provision does have to fit under those requirements that are already approved under each of the DDS waivers formally. Thank you.
No, thank you very much. I really appreciate that input. You know, from our perspective, we always are looking for concrete, even ranked measures, because when we are asked to put more money on one versus other by experts like yourself, you know, we are kind of a little less sharp on those. So it's great to know that something works on a scale of 0 to 10 at 9 and another one at 2, because it's a relative comparison which allows us to allocate or focus on that capital well. But I congratulate you on putting forward these metrics and measures, and I encourage you to really make it more friendly for us allocators in some sense as well. And with that, I'll yield it back to the chair. Thank you.
Thank you, Representative Aurora. Representative Dillon.
Thank you, Madam Chair, and good morning. Commissioner, it's good to see you so soon.
Good to see you as well.
If you recall, it went pretty late. We had testimony before the subcommittee hearing on Thursday from community providers about their ability to serve some of the people we're concerned about. And one of the providers, I believe, and I could be in error this morning, testified that that her organization had identified 3 people at Southbury, but were unable to transition them out. I'm not sure that it would be fair to the committee, given that we're supporting a broad policy, to get into the comparison, but I do want to flag that I am a little bit concerned going forward about the capacity of the system to absorb all these transitions, and how the transition that we're rewarding in transitioning out from the CRS will square with your transitioning people out of Southbury, if you understand my question.
I think I do, Representative Dillon, and there was a lot of compelling, important testimony that you folks listened to well into the late evening, early morning. I wanted to, so with specific regards to Southbury, there are a number of obstacles in play right now, not the least of which is the cost of real estate and the reasonableness of home purchases to accommodate transition. That's a conversation we have at the table, the Messier Settlement Agreement, through with someone who provides oversight to both the plaintiff and the defendant in that matter, and that has been an obstacle. Second, and not in rank order, but just second in the order I'm presenting them, is the staffing crisis that you all heard much about the other night. And we are hopeful that within what we're providing here, that will allow for sign-on and retention and increase to at least temporary increase to wages or incentivizing increases, in addition to what the secretary's already approved, moving us to $17.25 as a minimum wage within our sector on July 1st, that we can start to gain some momentum there with the Southbury concern. I have to take a broader concern, as we have families on the wait list as well as families already receiving services at Southbury, and how we get both of them what they need in community-based settings. So I appreciate you noting it. It's really complex. We could spend a lot of time just talking about Southbury specifically, as we have historically for many years, but I appreciate you raising the question. I hope I answered it.
Thank you. And I know what you weren't going to be responding to the subcommittee questions until tomorrow, I guess. But I don't think it would be fair to people here to get into what you've correctly identified as a very, very complex issue. But we are also talking about many family members who are quite distressed about the level of support or about the continuity of care that their loved ones can enjoy, given that we are all mortal. And if you have an adult child, you're going to be worried about how they will be cared for. And so, and we also have a real estate crisis, as you say, where we have a lot of uses chasing a very limited number of properties for a number of reasons that are even more interesting. So thank you very much for answering this morning, but I know that we're going to be continuing that conversation. Thank you.
Thank you very much, Representative Dillon. Representative Buckby.
Thank you, Madam Chair. I apologize for the phone ringing in my office, but I'm going to try to stay on point here. Commissioner, more of the IDD population has chosen to stay home, especially in the last 2 years. And I want to make sure we take care of the families that are home caring for them. The program for family home care was in place during the pandemic. And does this waiver do anything to extend that for them?
The authority, I believe the authority for that was removed, that we cannot gain access to that through Appendix K. I'll defer to my colleagues just to reinforce that. One of the things that's important to note is family members can get paid even outside of the emergency authority. What prevents them from getting paid is if they are the guardian or the employer of record. Those are the two caveats by which family members cannot get paid. And that puts families in a difficult situation to surrender that role in order to then be paid. And so I understand the very delicate nature of that request, but those, due to federal oversight and the concerns for waste, abuse, and fraud, those elements were included in the way that we can pay family members historically. They were temporarily lifted during the state of emergency, but I'll go back to Krista and Nick. I don't believe that they were, they would allow us to continue that outside of the emergency authority.
Thank you, Commissioner. Good morning, Representative Buckby. Nice to see you. So, Commissioner, the Commissioner's statement, it was accurate. The provision that allowed us to pay guardians through Appendix K ended in July of 2021. And outside of Appendix K, our current waivers don't allow us to pay guardians or employers of record if they're providing the supports. So just reiterating the Commissioner's points. Thank you.
I appreciate that, and thank you both for your answers. I think the concern we have is there a way to override the guardian, or is there any plan on your behalf to move forward to help those families who are in that situation without turning over guardianship to the state?
We would have, we would have the ability to have conversations with families about alternative ways to pursue that. I can tell you that for the most part, those alternatives have not been palatable to most guardians. So within our self-directed services, you can use a portion of your funds to bring in what we call a goods and services broker, which allows them to handle a lot of the administrative portions that would normally fall to a family member, and that then takes them off the hook, so to speak, for being the employer of record, and would allow them to work. But one of the features of the self-determined program is the autonomy and control a family and individual has. So there are some limited paths out. There is national conversation at the federal level about moving towards family-based payments to allow families to be paid for services to be provided. I'm not sure where in the context of federal conversation that conversation lies, but I know that there has been ongoing conversation even before the pandemic about trying to change that. And I don't know if any of my colleagues from either DSS or DDS comment on where that stands at the federal level.
I see Krista shaking her head, and of course, yeah. And Krista's heard recently from our from constituents in New Milford as well that are facing this challenge as well as across the state. And I really hope this conversation can certainly continue. It is something that is really overlooked across the board, and something that did help during the pandemic tremendously with some of these families. So I thank you so much for the time, and Madam Chair, thank you for allowing me the time for a couple of questions. Thank you.
Thank you, Representative Buckby. Representative McCarty.
Yes, thank you very much, Madam Chair, and welcome, Commissioner. Thank you for your report. I was just wondering, with respect to the retainer payments, if you would comment a little more. I noticed those were outside of the ARPA funds. I was not a little unclear as to that. And also, would the percentage of the federal match be the same for these type of services as these payments as well?
So I'm going to defer the second part of your question to Nick in terms of what would be covered under federal reimbursement, both at our regular match and the enhanced match. The reason for separation from the other items was specifically requested by CMS to pull that out and do that separately. That mechanism has been used broadly across the country for provider stability, and I think that they wish to have that tracked specifically related to the emergency. For services, for provider stabilization, retainer payments that stabilize the provider community. And And so that the reason it's separate is at the federal direction of the feds. Nick, in terms of percentage match in the periods covered, do you have detail on that?
So as far as the ARPA payments are concerned, if we can get approval and payments out before March 31st, then we would get the typical match. And in addition to that, the extra 10% match. If we are to release these payments after March 31st, then we would just get the traditional match on them.
So, excuse me, but so what I was trying to determine is whether these were the same percentage because they're outside of the ARPA funds, but.
Oh, I see.
Yeah.
So the retainer payments are the regular percentage. Those have to do with other payments that we've already made to providers. And it's really a mechanism to get reimbursement for the state. So payments are out the door, providers have money in hand, and we're just trying to figure out how we can get as much of that reimbursed and back into Connecticut as possible.
Okay, so that would vary then. Okay, thank you very much.
Thank you, Representative McCarty. Are there any other questions? Seeing none. Both DDS and DSS are free to go, and we're going to go on to the public.
Thank you for your time today, everyone. I appreciate the questions and the discourse.
Madam Administrator, can you let me know when you have let in the public?
I believe they're in.
Okay.
People are in, Madam Chair.
Thank you. Dwayne Gordon. Dwayne Gordon, are you in? If not, we're going on to Yvonne Foster. Is Yvonne Foster in? Lisa Emmer. Lisa Emmer, are you in? Cecile Smith. Cecile Smith. Ida Robinson. Ida Robinson, are you in? Gloria Duquette. Gloria. Mary Brighton. Mary Brighton. Marta Sanchez. Marta Sanchez. Bonnie Goudreau. Bonnie Goudreau. Paulette Belen. Paulette Belen. Denise Pinella. Denise Pinella. Anna K. McCullough. Anna K. McCullough. Alicia Freeman. Alicia Freeman. Michael Furlow. Michael Furlow. Nathania Garin. Nathania Garin. All right, I don't see anybody from the public here. I'm going to close this part of our public hearing, and all of the commissioners and the commissioner staff, you can all go. We're going to have a committee meeting now.
Human Services Committee will vote first, Madam Chair.
Yep. So this committee, the committee meeting, we're going to call the committee meeting to order, and I'm going to turn this over to Representative Abercrombie.
Thank you, Madam Chair. Good morning, everyone. This is just for the Human Services Committee. I will entertain a motion for the proposed Appendix K amendments to the DSS, DDS Medicaid waivers. Can I have a motion, please? Say your name first and then the motion.
The more motions.
Representative Hughes, second.
Thank you. Any questions or comments? Seeing none, Madam Administrator, please call the roll.
Thank you, Madam Chair. This is to approve the proposed Appendix K amendments to DSS and DDS Medicaid waivers. Representative Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore, yes.
I'm sorry, Senator, could you repeat that, please?
Moore, yes.
Thank you, Senator. Senator Berthel. Representative Case.
Representative Casey, yes.
Thank you. Senator Lesser. Representative Leeper.
Representative Leeper, yes.
Thank you. Senator Cabrera. Representative Butler. Representative Cook. Representative Dathan.
Representative Dathan votes yes.
Representative Garibay.
Representative Garibay votes yes.
Representative Goupil. Representative Hughes.
Representative Hughes votes yes.
Representative Santiago.
Santiago votes yes.
Representative Stallworth. Representative Aurora.
Aurora votes yes.
Representative Buckby.
Representative Buckby votes yes.
Representative Master Francesco. Representative Scott.
Representative Scott votes yes.
Representative Wood. Are there any members of the Human Services Committee who have not had the opportunity to vote yet who would like to do so now?
Representative Butler. I
Hello,
was on
Representative
mute
Butler.
when I gave my vote. Yes.
Thank you, Representative Butler.
Senator Lesser votes in the affirmative.
Thank you, Senator Lesser. Any other members of the committee?
Adam, please give us the tally.
Thank you, Madam Chair. Total number voting 13, total number voting yes 13, total voting nay 0, total abstaining 0, total absent not voting 7. Thank you, Madam Chair.
Thank you. Since this is a joint hearing, we cannot keep the votes open, so we will recess the Human Services Committee and turn it back over to Senator Austin for the appropriations.
Thank you very much, Representative Abercrombie and Human Services. I'll entertain a motion for the proposed Appendix K amendments to DSS and DDS Medicaid waivers.
So move, Nolan.
So, second.
Representative Nolan makes the motion. Representative McCarty seconds it. Any discussion? Seeing none, Madam Administrator, if you could call the roll.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Representative Walker votes in the affirmative.
Senator Hartley.
Morning. You want 4? Yes, please.
Representative Dathan.
Representative Dathan votes yes.
Representative Nolan.
Nolan votes in the affirmative.
Senator Minor.
Senator Minor votes yes.
Representative France.
Representative France votes yes.
Representative Abercrombie.
Representative Abercrombie votes yes.
Senator Doherty Abrams. Senator Anwar. Representative Baker.
Representative Baker votes yes.
Representative Betts.
Representative Betts votes yes.
I need to see you, please, sir.
Can you see me?
Nope.
There we go.
There you are.
Thank you.
Thank you. Representative Belinsky.
Representative Belinsky votes yea.
Representative Candelaria.
Representative Candelaria votes yes.
Senator Chicarella.
Senator Chicarella votes yes.
Representative Curry.
Representative Curry votes in the affirmative.
Representative Delaney.
Representative Delaney votes yes.
Representative Dillon.
Representative Dillon votes yes.
Representative Felipe.
Representative Felipe votes yes.
Representative Ferraro.
Representative Ferraro votes yes.
Senator Flexer.
Senator Flexer votes yes.
Representative Gibson. Representative Gilchrist.
Representative Gilchrist votes yes.
Madam Administrator.
Yes, hi, Representative Gibson.
Hi, sorry about that. Representative Gibson votes yes.
Thank you, sir.
You're welcome, ma'am.
Representative Haddad. Representative Carol Hall. Representative Joshua Hall. Representative Harrison.
Representative Harrison votes yes.
Representative Hayes.
Representative Hayes votes yes.
Representative Howard.
Representative Howard votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Senator Kushner votes yes.
One more time for me, ma'am.
Senator Kushner votes yes.
Thank you. Senator Lesser.
Senator Lesser votes yes.
Senator Lopes.
Senator Lopes votes yes.
Representative Luxembourg.
Luxembourg votes yes.
Representative McCarty.
Representative McCarty votes yes.
Senator McCrory. Senator McCrory, I saw you earlier. Representative Harris.
Representative Paris votes yes.
Representative Pavlak D'Amato.
Pavlak D'Amato votes yes.
Representative Porter. Representative Reyes.
Representative Reyes votes in the affirmative.
Representative Rosario.
Representative Rosario votes in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Representative Sanchez. Representative Sims.
Representative Sims votes in the affirmative.
Senator Summers. Representative Terziak.
Representative Terziak votes yes.
Representative Wilson.
Representative Wilson votes yes.
Senator Winfield. Representative Zawistowski. Hi, Representative Haddad.
Thank you. Representative Haddad votes yes.
Thank you. Are there any members of the Appropriations Committee who have not yet voted who would like to cast their vote?
Yes.
Hi.
Representative Zawistowski votes yes.
Thank you, ma'am.
Good morning, Sue. Senator McCory votes in the affirmative.
Thank you, sir.
Representative Gonzalez vote yes.
Thank you, ma'am. Anyone else?
Madam Administrator, do you have the tally?
I do, Madam Chair. Total number voting 42, those voting yea 42, those voting nay 0, those abstaining 0, those absent not voting 9.
The motion passes. I would entertain, Madam Administrator, do you want to go over anything that we have going on? Well, let's do that afterwards. I'll entertain a motion to adjourn this meeting.
Moved by Abercrombie.
Representative
Garcia.
Abercrombie, seconded by Senator Minor. All those in favor indicate by saying aye.
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 The Appropriations Committee meeting is adjourned. Representative Abercrombie.
Thank you, Madam Chair. I will entertain a motion to adjourn the Human Services Committee meeting.
So moved by Santiago.
Second,
Rep Hughes.
all those in favor signify by saying aye.
Aye.
Human Services meeting is adjourned. Thank you, everyone.
And Madam Administrator, what do we have going on the rest of the day today in appropriations?
We are very busy today, Madam Chair. Our heads are spinning. We actually have 4 subcommittees that will be meeting. The first is Conservation and Development at 10 o'clock. They're meeting with the Department of Labor and the Department of Economic and Community Development. This afternoon, we have 3 subcommittees meeting at 1 o'clock. Regulation and Protection will be meeting with DESP, DCP, and the Military Department. General Government A will be meeting with the Office of Workforce Strategy, the Secretary of the State's Office, Freedom of Information Commission, and the State Contracting Standards Board. And the Human Services Subcommittee will be meeting with the Department of Aging and Disability Services. And just as a reminder to members, we have a public hearing scheduled for Thursday at 3 p.m. on the infrastructure oversight bill that we raised a couple of weeks ago, a week or so ago. It is only a public hearing. There is no committee meeting to follow, so there will not be votes.
Thank you very much, Madam Administrator. And so I will see some of you on the on and off all day today, and I look forward to the conversations that we'll have.
Madam Chair, before we go, if I can do a little public service announcement to those of folks who are listening. I have instituted something new as of this morning, as of probably about 15 minutes ago, actually. The daily schedule of appropriations work sessions, subcommittee work sessions, will be posted on the Appropriations Committee website. I've created a folder, and I'm going to be popping the daily schedules into that folder so that the members of the public have an opportunity to see with whom our subcommittees will be meeting.
Thank you very much, Madam Administrator. Always good to have someone that's organized.
Thank you.
Really appreciate it.
Madam Administrator, may I make an announcement about the Human Services schedule?
Absolutely.
Thank you. Human Services will be having a public hearing tomorrow morning at 10 o'clock a.m.
Thank you. All right, guys. See you all later. Bye.